Welcome back to the show. It is great to have you along on this Monday night. From virtual reality personal care to digital records, a recent survey by Research and Insight asked Ontarians about the services they'd like to see in their doctor's office or clinic of the future. Some of the top responses: ability to book appointments online, more than 60%. Immediate access to test results, 59%. Online access to personal medical records, 58%. Other findings found that younger Canadians, 18 to 34, had a much higher preference for personalized care compared to older Canadians, while older Canadians ranked electronic medical sharing higher than younger Canadians. Joining us to talk about this survey is Heather Shantora, CEO of InnoCare. Hi, Heather. Thanks for doing this.
Hi, Barb. Thank you.
What exactly does InnoCare do?
We are actually a supplier of electronic health medical records, but we provide it to the other healthcare practitioners other than physicians. So, for example, physiotherapists, massage therapists, chiropractors, etc.
Okay, so let me understand this, because we've got a lot of disappointment and confusion in Ontario regarding eHealth. Mm-hmm. So eHealth was this idea of electronic records that I don't think has been fully implemented.
Correct.
Okay. So, and that would have been for physicians, for hospitals, where this is to different kinds of doctors.
It's for clinicians that aren't doctors, so other healthcare providers, nurses, physiotherapists, etc. So the vision for eHealth was really about interoperability of healthcare records between physicians and hospitals. We actually handle everyone outside physicians because not a lot of the big companies pay attention to all those other clinicians. But when you think about optometry, physio, there's huge numbers of clinicians out there that aren't given the same attention as it relates to EMR as physicians are.
So what is the purpose of coordinating the medical records among other healthcare professionals?
Great question. It really has to do with doing two treatment plans that are contraindicated. So, for example, if you were in line to see an orthopedic surgeon and you have back trouble, you need your physiotherapist to know that. You don't want them doing exercises with you that are contraindicated to what the surgeon would want. So the fact that these two sets of electronic medical records don't speak actually is a little bit dangerous.
So your company gets those healthcare practitioners on board with you, and then you share all of the information with them?
The goal is to share all of the information with them. So we supply the software for clinics as well as some of the services like answering their calls and doing some of their back office work. But our goal would be to integrate with physicians' electronic medical records. But we're not there yet, and it's down to eHealth and the things you've described, where there just doesn't seem to be the ability to be able to get this together and allow these information sharing back and forth. But when you look at other sectors like banking, which is probably equally as important to us Canadians and personal, they seem to have it together. You can go to one bank and retrieve your money, which is stored in another bank, and yet we can't get it together when it comes to medical records.
Heather Shantora is my guest, CEO of InnoCare, a Canadian-based healthcare technology company. Let me put this to you, Heather, because this is one thing that I heard years ago when it came to the whole eHealth thing, and I think a lot of people sort of misunderstood where things were at. I understood that the whole system has been up and running and ready to go for a long time, but the problem was getting all of the physicians to embrace the idea of using this technology.
Oh, that's interesting. So my understanding is it's actually the clearinghouse of the information, where it's actually the software suppliers who essentially the clearinghouse speaks different languages, and so the information was not able to be shared between the two or three or four different companies. So
in terms of the survey that we were talking about, one of the things I wanted to ask you about is I have been surprised to find that a lot of people don't realize they own their medical records.
That's very true, and I think they don't realize that because they typically don't have access to it, and that's one of the things that came out in the survey. It's extremely important to Canadians that they have online access to their personal medical records. 57% of them said that was important to them.
And is this something that's realistic, that we should be able to go online and access our medical records?
Absolutely. If I were to, again, create the parallel to banking, there's really no more data privacy or anything than there would be with banking. Banking is governed by the same privacy laws and has, the same amount of personal information, but we don't seem to be able to have the same level of access as it relates to our healthcare records.
What needs to change in order for everyone to be able to coordinate all of the records?
So InnoCare is a private company, and I believe that, in private sector, there's a lot of innovation that's constantly driving the company so that they can continue to compete. I think some of that innovation needs to be brought to eHealth Ontario and some of these initiatives, because I actually think it's just innovation. Technologically, it's possible. It's really down to will at this point.
Heather Shantora, interesting stuff. Thank you so much for this.
Thank you, Barb.
Heather Shantora, CEO of InnoCare. They're looking to coordinate medical records among healthcare practitioners that are not physicians, and eHealth is the one where it didn't seem to get off the ground. But I think, from what I've heard anyway, it's been up and ready to go for a long time, but it's just a matter of coordinating everybody and getting everybody on board to use it. Okay.